Welcome back to the Great Indian AI Podcast channel for another deep dive, this time into the world of scientific discovery. Today, we're tackling a virus you've likely encountered.
But might not know by name.
Exactly. Human Metapneumovirus, or HMPV.
It's one of those viruses, kind of flown under the radar for a long time, but it has a significant impact, especially on young children and older adults.
Exactly. And with the recent outbreak in China making headlines, it's more important than ever to understand what HMPV is all about. So stick with us on the Great Indian AI Podcast channel. We'll cover the story of HMPV, from its relatively recent discovery to the ongoing research that's paving the way for future treatments and vaccines.
It's a fascinating journey through the world of virology, with implications for global health.
Absolutely. Now let's start with the basics. What exactly is HMPV? And how does it compare to other respiratory viruses we're more familiar with, like RSV or the flu?
Well, HMPV is a single-stranded RNA virus, which means its genetic material is RNA rather than DNA, and it actually belongs to the same family as RSV.
Oh. The Pneumoviridae family.
Interesting.
So you can think of them as close cousins, both causing similar respiratory illnesses.
Okay, so that explains the family connection. But why is HMPV so often overlooked? I mean, if it's as common as RSV, shouldn't we be hearing about it just as much?
That's a great question, and it has a lot to do with the timing of its discovery. HMPV was only identified in 2001.
Wow.
Which in the world of virology is quite recent.
Wow, 2001, that feels like yesterday. So for decades, it was circulating undetected, causing all these respiratory illnesses.
Exactly. It was hiding in plain sight, often misdiagnosed as a common cold or even RSV.
It makes you wonder how many other viruses are still out there waiting to be discovered. But how did they finally pinpoint HMPV? What led to that breakthrough moment?
It's a testament to the power of scientific curiosity and persistence. A Dutch scientist named Bernadette G. van den Hoogen and her team were studying children with respiratory illnesses. They were finding cases where the usual suspects like influenza and RSV were ruled out.
But the children were clearly sick.
So there was this missing piece of the puzzle.
Precisely. And they had a hunch that there might be another virus at play. So they used a technique called RAP-PCR, which helps detect viral genetic material, even if it's present in very small amounts. And that's how HMPV finally emerged from the shadows.
That's incredible. Imagine the feeling of discovering a completely new virus. It's like finding a new species hidden in the rainforest.
It's a remarkable story, and it highlights the fact that we're still learning so much about the world of viruses.
Absolutely. Now that we know HMPV exists, the next question is, how widespread is it? Is it something we should be concerned about here in India?
The answer is a resounding yes. HMPV is found worldwide, and studies suggest it's been circulating for at least 50 years, so it's not a new virus, but rather one that's been recently identified.
50 years. That's longer than I've been alive. And it makes you realize just how interconnected we are globally when it comes to infectious diseases. But if it's so common, why don't we hear about it more often?
Well, for one, the symptoms of HMPV are very similar to other respiratory illnesses, like RSV and the flu. Think cough, runny nose, fever, sore throat. It can be tough to distinguish them without specific testing.
So it's like a chameleon of viruses, blending in with the crowd. And this leads to the question that's probably on everyone's mind. Just how serious is HMPV? Should we be worried?
Well, it's important to remember that like most respiratory viruses, the severity of HMPV infection can vary widely. For most healthy adults and older children, it might just feel like a bad cold.
There's a few days of feeling miserable, and then you bounce back.
Exactly. But for certain groups, HMPV can pose a much greater risk. We're talking about infants younger than 6 months, older adults, especially those with underlying health conditions, and individuals with weakened immune systems.
So similar to the flu in terms of who's most vulnerable.
Yes, there are definitely parallels there. For these vulnerable groups, HMPV can lead to more serious complications, like bronchiolitis, pneumonia, and even respiratory failure. In fact, in older adults, HMPV can be as severe as influenza, sometimes even requiring hospitalization.
That's certainly concerning. And with the current outbreak in China, it's a good reminder that we need to stay vigilant, especially when it comes to protecting those who are most at risk.
Absolutely.
But before we dive deeper into the outbreak and its implications, let's take a closer look at how HMPV compares to its viral relatives, RSV and influenza.
Okay,
so we've established that HMPV, RSV, and the flu can cause very similar symptoms. Are there any key differences that might help us tell them apart?
Well, one difference is the timing of their peak seasons. RSV typically hits infants the hardest around 2 to 3 months of age,
Okay.
while HMPV hospitalizations peak a bit later, closer to 6 to 12 months for babies.
Okay.
Influenza, on the other hand, tends to circulate more prominently in the winter months.
So it's not just one big season of respiratory misery. It's more like a relay race of viruses, with each one having its own time to shine.
That's a great analogy, and it highlights the importance of being aware of the different respiratory viruses circulating at different times of the year. It can help us be more prepared and take appropriate precautions.
Speaking of precautions, how exactly does HMPV spread? Is it similar to how colds and the flu spread?
The culprits are the usual suspects: coughing and sneezing, close contact like touching or shaking hands, and touching contaminated surfaces than touching your face. It's pretty much the same playbook as other respiratory viruses.
Which explains why good hygiene practices like hand washing and covering your coughs and sneezes are so crucial. But here's the million-dollar question. Is there a cure for HMPV? Or a vaccine to prevent it?
Unfortunately, as of right now, there's no specific treatment for HMPV. The good news is research into antiviral therapies and vaccines is ongoing, and there are some promising developments on the horizon. For instance, studies in animals have shown the antiviral medication ribavirin to be effective against HMPV.
So ribavirin could be a potential weapon in our arsenal against HMPV. What about the vaccine front? Any breakthroughs there?
Yes, Moderna is developing an mRNA vaccine for HMPV, which has shown positive results in early trials. It's still early days, but it's definitely a beacon of hope.
It's reassuring to know that scientists are working tirelessly to find solutions. But until those solutions are readily available, what can we do to protect ourselves and our loved ones from HMPV?
The same advice that applies to preventing other respiratory viruses holds true for HMPV. Wash your hands frequently, avoid close contact with people who are sick, and stay home if you're feeling under the weather. It might sound simple, but these measures can significantly reduce the spread of the virus.
These are the tried and true methods that we've all become accustomed to, especially after the COVID-19 pandemic. They might not be glamorous, but they work.
Exactly, and it's a reminder that we all have a role to play in protecting ourselves and our communities.
Welcome back to the Great Indian AI Podcast channel. Now let's zoom in on the current HMPV outbreak in China. It's making headlines and it's a bit unsettling. Can you give us a sense of the scale and severity of this particular outbreak?
Yeah, it definitely is a situation that warrants attention.
It is.
The outbreak in China is significant, with a large number of cases reported, particularly in certain regions. It appears to be driven by a particular strain of HMPV, and researchers are working to understand its characteristics, including its transmissibility and virulence.
Right.
Transmissibility and virulence, those are the key factors that determine how easily a virus spreads and how sick it can make people. So are we seeing more severe cases with this outbreak compared to previous HMPV seasons?
It's still too early to say definitively, but there are reports of increased hospitalizations, especially among young children and older adults. However, it's important to remember that during any outbreak, healthcare systems can become strained,
leading to more people seeking medical attention, which might skew the perception of severity.
That makes sense. And it highlights the importance of accurate data and ongoing monitoring to get a clear picture of what's happening. What are the implications of this outbreak for healthcare systems, both in China and globally?
Well, outbreaks like this one can put a significant strain on healthcare resources, particularly in areas with limited capacity. We're talking about increased demand for testing, hospital beds, and medical personnel.
Yeah.
This can lead to longer wait times, delayed care, and potentially a shortage of essential supplies.
And those challenges aren't confined to one country, are they?
No, absolutely not. In our interconnected world, an outbreak in one region can have ripple effects globally. This is especially true with HMPV, considering it's a respiratory virus that spreads easily through travel. So while the epicenter of this outbreak is in China, it's a reminder that we need to be prepared for potential cases and even localized outbreaks in other parts of the world, including India.
Right. This brings up the importance of global health surveillance and collaboration. Are there systems in place to monitor and track the spread of HMPV internationally?
Yes, there are. Organizations like the World Health Organization, WHO, play a crucial role in monitoring infectious diseases globally.
Okay.
They collect data from various countries, track outbreaks, and provide guidance on public health measures. There's also increased collaboration among research institutions worldwide, sharing information and working together to understand HMPV's evolution and transmission patterns.
That's good to hear. So it's a coordinated effort to keep tabs on this virus and be prepared for any potential surprises it might throw our way.
Exactly. And this collaboration becomes even more critical when we're talking about vaccine development, because HMPV strains can vary from region to region.
Right.
Developing a vaccine that's effective against all circulating strains is a major challenge.
It's like trying to hit a moving target.
It is.
The virus is constantly evolving, and scientists are racing to keep up.
Precisely. But let's shift gears a bit and talk about those promising developments in HMPV research, particularly the potential for vaccines. This raises some important ethical considerations, doesn't it?
It certainly does. When developing and distributing vaccines, it's crucial to prioritize fairness and equity.
Absolutely.
We need to ensure that vaccines are accessible to those who need them most, regardless of their socioeconomic status or geographic location.
Exactly. Ethical considerations also extend to the research process itself. Clinical trials need to be conducted ethically with informed consent from participants and a focus on transparency and safety.
It's about balancing the potential benefits of a vaccine with the rights and well-being of individuals.
Precisely. And as we move forward with HMPV vaccine development, it's crucial to have open and honest conversations about these ethical considerations involving diverse perspectives and stakeholders.
Speaking of moving forward, what does the future hold for HMPV research? What are scientists focusing on, and where are the biggest knowledge gaps?
There are several key areas of focus in HMPV research right now. One is understanding the virus's evolution in more detail. By analyzing the genetic makeup of different HMPV strains, scientists can track how the virus is changing over time and identify potential targets for vaccines and antiviral drugs.
So it's like piecing together a puzzle, trying to figure out how HMPV is adapting and mutating.
Yes, and this knowledge is crucial for developing long-term solutions. Another area of focus is improving diagnostic tools.
Okay.
Currently, diagnosing HMPV requires specialized laboratory tests, which aren't always readily available, especially in resource-limited settings. Scientists are working to develop more rapid and affordable diagnostic tests that could be used in a wider range of healthcare settings.
That would make a huge difference in identifying cases quickly and implementing appropriate control measures.
Absolutely. And of course, the development of effective antiviral therapies and vaccines remains a top priority. The success of mRNA vaccines for COVID-19 has paved the way for exploring similar approaches for HMPV, and early results are encouraging.
That's definitely a reason for optimism. But beyond the science itself, are there any broader challenges or considerations when it comes to tackling HMPV?
One of the biggest challenges is raising awareness about HMPV. Because it's often mistaken for other respiratory illnesses, it doesn't always get the attention it deserves. Increased awareness among the public and healthcare professionals is essential for prompt diagnosis, appropriate treatment, and effective infection control measures.
So it's not just about the science, but also about educating people and ensuring that the knowledge translates into action.
Precisely. And this is where platforms like the Great Indian AI podcast channel play a crucial role. By sharing this information with our listeners, we're helping to shed light on HMPV and empower people to make informed decisions about their health.
It's all about making knowledge accessible and engaging, which is what we strive to do here on the Great Indian AI podcast channel. Well, we've covered a lot of ground in this part, from the challenges of the current outbreak to the exciting possibilities on the research horizon, but there's still more to explore. In Part 3, we'll delve into the potential role of artificial intelligence in predicting and preventing future HMPV outbreaks.
We'll also discuss the socioeconomic impact of HMPV and explore what steps can be taken to mitigate the burden of this often overlooked virus.
It's a fascinating intersection of science, technology, and global health. So stay tuned for the final part of our HMPV deep dive, coming up right after this. Welcome back to the Great Indian AI podcast channel for the final part of our deep dive into human metapneumovirus.
It's been quite a journey exploring this often underestimated virus.
It really has.
Sure.
We've discussed its discovery, the tricky symptoms, how it spreads, and the ongoing quest for effective treatments and vaccines. But now, let's broaden our perspective and consider the wider impact of HMPV.
That's a crucial point. We often focus on the immediate health effects, but the ripple effects of HMPV outbreaks can extend far beyond individual cases.
Exactly. So let's talk about the socioeconomic impact. What kind of burden does HMPV place on communities and healthcare systems, especially in countries like India?
Well, imagine a scenario where hospitals and clinics are flooded with patients suffering from respiratory illnesses. many of them young children and older adults. This surge in demand puts a strain on healthcare resources, from staffing to bed availability to essential medical supplies.
And it's not just about the capacity to treat patients, right? There's also the economic impact to consider.
Absolutely. Outbreaks like the one we're seeing in China can lead to significant economic losses due to missed work and school days, both for those who are ill and for those caring for them. It disrupts productivity and can have a domino effect on various sectors of the economy.
And in developing countries where access to healthcare is already limited, these outbreaks can exacerbate existing inequalities.
Precisely. It's a stark reminder that global health is interconnected, and that outbreaks in one part of the world can have far-reaching consequences. We need to consider HMPV not just as a health issue, but also as a social and economic challenge.
So, addressing HMPV requires a multifaceted approach. It's not just about developing vaccines and treatments, but also about strengthening healthcare infrastructure and addressing social determinants of health.
Absolutely. We need to invest in preventative measures, like improving sanitation and hygiene practices, ensuring access to clean water, and providing adequate nutrition. All of these factors contribute to a population's resilience against infectious diseases, like HMPV.
It's a holistic approach that considers the interconnectedness of health and well-being.
Exactly. And this brings us to the fascinating realm of artificial intelligence. AI has the potential to revolutionize how we approach infectious diseases, including HMPV.
Okay, I'm intrigued. How can AI be used to combat a virus like HMPV?
Well, AI excels at analyzing vast amounts of data and identifying patterns that humans might miss. Imagine feeding AI algorithms with epidemiological data, viral genomes, environmental factors, and even social media trends.
Well, we're talking about creating a comprehensive picture of HMPV by harnessing the power of big data.
Precisely. AI can help us track the spread of HMPV in real time, predict potential outbreaks, identify high-risk populations, and even assist in developing targeted interventions.
So it's like having an early warning system for HMPV, similar to how we use technology to forecast the weather.
That's a great analogy. AI can help us be more proactive in our approach to HMPV, rather than reactive. We can move from simply responding to outbreaks to anticipating and preventing them.
That sounds like a game changer in the fight against infectious diseases. But AI is just a tool, right? Its effectiveness depends on the quality of data and the expertise of those using it.
Absolutely. It's not about replacing human intelligence, but rather augmenting it. AI can provide us with powerful insights, but it's up to scientists, public health officials, and policymakers to translate those insights into actionable strategies.
It's a collaboration between human ingenuity and technological innovation.
Exactly. And platforms like the Great Indian AI podcast channel play a crucial role in bridging the gap between these two worlds. By discussing these advancements in an accessible and engaging way, we're fostering a dialogue that can lead to meaningful change.
Well said. And speaking of meaningful change, as we wrap up this deep dive into HMPV, I want to leave our listeners with a sense of hope and empowerment.
Yes, although HMPV is a formidable opponent, we're not powerless against it. The scientific community is making significant strides in understanding this virus and developing solutions.
We've seen how research into antiviral therapies and vaccines is progressing, and how AI can be harnessed to predict and prevent outbreaks.
But it's not just about scientific advancements, it's also about individual actions. Each of us can play a role in protecting ourselves and our communities by practicing good hygiene, staying informed, and supporting public health efforts.
It's a collective effort that requires collaboration, awareness, and a commitment to global health.
And remember, knowledge is power. The more we understand about HMPV, the better equipped we are to combat it.
Well, this has been an incredibly insightful journey into the world of human metapneumovirus. Thank you for joining us on this deep dive here on the Great Indian AI podcast channel.
It's been a pleasure sharing these insights with you.
We hope you found this episode informative and empowering.
If you did, please show your support by liking, sharing, and subscribing to the Great Indian AI podcast channel.
Your support helps us reach a wider audience and continue to bring you insightful explorations into the world of science and technology.
Until next time, stay curious, stay informed, and stay healthy.